To begin the process of understanding the iPatient Care EHR note and how it operates, it's important to understand the three primary operations which lend to the navigation within the note. And that would be the note sections, the note systems, and the macro elements. So the note sections are primarily based on current documentation guidelines. And so you can think of that as your basic outline of your note. This has been developed for you already based upon our compliance expertise, which used the guidelines from Medicare, commercial payers, and state licensing board requirements as the reference point for you as a provider. Secondly, the note sections only show in the finished note if the macro elements within the note section have been fully completed, which we will cover that in just a few minutes. The note sections can be made visible in the patient portal and the iPad app, and this would be part of the editing feature when a note section is developed. In addition, under the Copy Previous function, which we will cover as well in this module, transfer of note sections from one note type to the other is a great feature. And then finally, the key elements of the patient's file, such as the past family medical social history, review of systems, care plan, can be present in each note type by just simply bringing those sections into the note type that is developed. And this has been shown to enhance the multidiscipline treatment of the patient through better communication of treatment plans, of history elements. It allows for all provider types to access that same information. So the note sections, you can think of that as the backbone, the main outline, if you will, the headings of the note. Next, we have what are called note systems. Now, note systems are assigned within each note section, and this allows for the ability to further categorize or subdivide components within the note itself. And note systems are assigned when developing and editing the note sections in the administration side of the EHR system. And then finally, the third element that we're talking about here to help us navigate and understand the navigation and operation of the iPatient Care EHR note are what are called note macro elements. Now, there are 9 different macro element format options available to provide maximum personalization of the note. Very key from a compliance perspective is to make sure that the patient chart is authentic for the date of service. And this requires the ability to be able to customize that individual note. And through these 9 different macro element format options, it allows you that opportunity to put key information into the patient record that is relevant for that time of service. Secondly, it operates within a 3-column structure and operates from left to right as the note is completed. In addition, CPT and other types of codes may be individually assigned to a macro element, and this code is available for extraction in the charge capture section of the note, where the ICD-10 and CPT codes are linked and note is signed prior to it automatically creating a claim for billing in the system. Now, this is very much appreciated from the provider standpoint and the biller standpoint, this particular function. Why is that? Well, when a provider completes a note, that CPT code will drop into that charge capture area, making it very easy for the provider to not forget to charge out a procedure. But the second part of this is that if the note is not completed like it should be in that procedure section of the note, then that CPT code will not drop. And when that's identified, it forces the provider to go back to that procedure section to complete the note and to maintain compliance with coding and documentation requirements. And then finally, each macro element, depending on the format used and the default verbiage that could be assigned, again, must be fully completed for it to show up in the finished note. So what does a finished note look like? Well, it's always good to begin with the end in mind. And so we will walk you through an example of a finished note. And as you can see, there are 6 pages to this initial visit note performed by one of our clients. Of course, this is all de-identified, but it gives you a good feel for how the system works and how it lays out. And so I'd like to direct your attention, first of all, to the header on the left upper part of the screen, where it will have the practice name and address and that information, in addition to the office visit, which is the note type, and the date, and then, of course, the patient's name, medical record number, date of birth, gender, so on and so forth. Then as you read through the note, you will see the blue or purple color that signifies the note section. And so we have a visit type note section. We have a HPI, or history of present illness, note section. We have a current medication note section. We have a subjective note section, objective note section, examination note section. These are the types of note sections that we referred to earlier. That is the outline of the note. Now, in addition to that, within those note sections, as we talked about, are note systems. And you can see those note systems, which are in bold and underlined. So under HPI, you'll see auto accident initial visit. That is a note system. You will see under subjective, NEC, that is a note system. You will see under objective, segmental dysfunction, that is a note system, as well as palpatory finding is a note system under that objective section. And then we move into the examination, and you'll see postural evaluation, observation, neurological examination, cervical orthopedic. And as we work through the note and see what this finished note looks like, you can see the various note sections and note systems that are underneath those sections. And so within the note section of subjective, we have a note system of NEC, which identifies that chief complaint. Within that note system of NEC, or that chief complaint, we have the macro elements. And so this is the completion of the note inside of that note system. And so you can see how that lays out. We move from the section to the system, and then we create or complete those macro elements that best describes and authenticates the clinical facts of that patient visit or encounter. So all throughout the note, as we move through it to completion, those sections, systems, and macro elements are documented. And then finally, in the charge capture, you will see services performed when that charge capture is completed, which brings together the diagnosis codes, the CPT codes, the linking of those codes, or the addition of any modifiers, and then once it is signed, a claim is created and pushed over to the billing side of the platform. And so let's go ahead and complete a note so we can see how this works in operation. And so as we mentioned, we've opened up the note. We understand now in looking at this note that there are note sections. Well, those note sections are identified in this column on the left-hand side. So we have visit type, visit number per plan, we have HPI, we have subjective outcome assessment, past family medical social history, review of systems, current medications, allergies, subjective, objective. These are the note sections, as we've talked about, that give that backbone and outline of the note. And again, how did we come up with these? Well, it's based on Medicare, third-party payer, and licensing board requirements as to what needs to be within the structure of a note. And this allows providers to achieve documentation that they perform to the standard of care that's required within their scope of practice. So let's move forward. So we have our sections. So we'll go ahead and select the visit type section. When we click on that, it opens up what visit types are available or have been programmed or set up within the system. And keep in mind, we have opened up a multi-D office visit note. And so we have various healthcare providers here that may have different types of visits. So under chiropractic, those visit types are best represented here: initial visit, new episode, progress eval, auto accident initial, acupuncture, so on and so forth. Under the medical, we have general physical exam. And then under physical therapy, very similar to the chiropractic. And of course, we do have a telehealth category that helps outline those types of visits that could be performed through telehealth. Now, the important part of this particular section, identifying the visit type, and we'll go ahead and make a selection here that this is an auto accident initial visit as a chiropractic provider, that two things occur. Number one, this note now will be labeled auto accident initial visit so that you can readily identify this note type within the multi-D office visit will be recorded as the title of this note. Secondly, you have the ability to bring in specific history of present illness requirements, questions, history documentation that would be required for that particular type of visit or chief complaint. And so in beginning to set up platforms for practices, this is a key area that we discuss with the practice to help them identify how they would like to utilize this particular function. Next, we'll go back to the sections again, and we'll move from top down and, of course, left to right. Visit number per plan is our next section. And so visit number per plan, this is an important feature when it comes to identifying what treatment visits you are within a specific plan, depending upon the number of visits. So chiropractic providers, physical therapy providers can document exactly where they're at within a treatment plan. This, by the way, is a Medicare requirement. Moving further down, history of present illness. We'll select that note section, and that opens up, as you'll see, the auto accident initial visit that we selected as a visit type. So then now we see these macro elements again, but in greater detail now that we're getting more into the note. What's important for documenting a history of present illness? Well, complaint locations are important to identify. In this particular case, since it was an auto accident initial visit, auto accident history questions, like the date of the MVA, the time. Was the patient unconscious at impact? Do they recall the details of the collision? Is the recollection foggy? What is the description, location, weather conditions? And as you make selections, you'll see macro elements continue to open up within this 3-column structure. And then you can go ahead and make those selections. And in the event that a macro selection is not sufficient, there are what are called free text boxes that you'll see within these column structures. These can be placed anywhere within the note, and this allows you the opportunity to go ahead and type in a text and select OK, and then that will lay that out within the note structure. And then we come back to our list. After that's completed, providers seen since the MVA. We didn't have any diagnostic tests after the MVA. We'll say that they had x-rays taken. Was there any missed work? Was there any missed school? And this is where that would be documented. And so if there was, you will see that there are part of the macro elements, a numbering system. Self-care remedies, any prior complaints, prior treatment, and prior diagnostic tests prior to the auto accident. And so you'll see that this begins that process of laying out, number one, what are those structural elements that are important in a history of present illness that builds the context of the patient's chief complaints. And then secondly, the ability to be able to complete and fully document each one of those elements that do pertain to the patient's case. Now, let's say, for instance, that we've gone through the macros and there's still more that we need to go ahead and document. Well, again, you can either utilize a free text box, as we've talked about before, which is right at the end of this, or what you can do is go ahead and click inside of this box. That opens up, and then it allows for you to go ahead and make changes to the record. And then just click OK. And that's in the record then. And you can fully customize whatever you need within that particular field of view. Now, if we go back to the left-hand side of the screen, subjective outcome assessment. So when we select subjective outcome assessment, this is where those outcome assessment tools are available to document through a valid tool a patient's disability or pain. Now, a key feature of these types of scoring forms within the iPatient Care EHR system is the ability to be able to drop in trends reports and graphics into the patient record, which show for that patient the results of previous outcome assessment tool measures. Next, as we move down past family medical social history, and of course this is where family medical history would be documented, the patient's past medical history would be documented, and of course their social history would be documented. Again, simply working from top down and left to right. Review of systems. The review of systems lays out in a nice, easy format, simply selecting those symptoms that the patient's identified as positive from your intake process. Current medications. Current medications can be documented simply by clicking the plus sign, which opens up the screen for you to be able to search within the pharmacy database and make the proper selection for the drug that the patient is on. This allows for that medication reconciliation and drug-to-drug interaction to be checked as well. The next section would be the allergies section, and the same mechanism of searching can be performed. Subjective section. This is the section that you would identify the chief complaints. So simply by selecting that the patient had a negative screen or any other information you would like to also document regarding COVID for the patient can be done in this section. Next, you would select that chief complaint, which we said early on in the history of present illness was neck, and you can begin to describe that chief complaint. Patient comes in with right-sided neck pain, radiating right arm pain to the right elbow. Current pain intensity is at a 4. Current pain frequency is frequent. Pain quality factors, aching, dull, numbness and tingling. Pain is aggravated by driving, coughing, carrying. Pain is relieved by ice, and it's getting worse. And there we've documented that chief complaint. Moving on to the objective. Since we are completing this as a chiropractic provider, you'll see that within the objective section, we have all of those palpatory findings that can be documented, including the spinal subluxation by identifying the region, the levels of asymmetry or misalignment, and then the paraspinal involvement, either left, right, or bilateral, and we will say right, and then documenting the level of tenderness, hypertonicity, and if there's active trigger point or edema. And you can see that that lays out per segment, and of course this supports the PART subluxation guidelines from Medicare. The same can be documented for upper extremity, right shoulder, the specific joint, and was it fixated, restricted, was there edema, is there tenderness, lower extremity, and rib subluxation, posterior, anterior, left and right, cranial subluxation, and then finally palpation findings. Now these would be for those areas that are auxiliary to the spinal muscle groups that we have already identified in the previous systems. And so for instance, in the cervical region, right upper trapezius, documenting the tenderness, hypertonicity, active trigger point present, had edema noted. Next, we'll go further down in our sections and click on vitals and document the vital signs for the patient for the day. Now, when you open this up, you'll see the history of the patient's vital signs. To document it for the day, you would simply again click on the plus to add a new vital sign. You'll see the date, the time, body temperature, pulse rate, respiratory rate. Is it normal, labored? Was the pulse rate regular or irregular? Body temp, taken temporal. That's set as the default, but you can see there's other options. Then the blood pressure, systolic and diastolic. Sitting, standing, supine, left, right. And then height, in inches, weight, in pounds, and you'll see that the BMI is automatically calculated. And then any other O2 saturation or other types of documentation that you may have that you would like to enter into the vital section can be done. And we click Save. And that brings it in for today's documentation of the vitals. Next, we move on to the examination section. Now, the examination section has been set up, as you can see, under the following systems: postural evaluation, observation, neurological, the orthopedic sections, and then finally general health. If we click open postural evaluation, we can begin right at the top, PA posture, and identify the findings, lateral, if there's antalgia, movement, ambulation. Moving into observation, you can identify bruise locations. Maybe in this case, since it's the motor vehicle accident, right shoulder region, maybe in the right flank. If any section or macro element is within normal limits, you can simply denote that by selecting within normal limits, and it will bring in all of the normal limit verbiage into the note. Next, we have neurological exam, gait analysis, and you can see again, left to right, upper extremity DTR, lower extremity DTR, upper motor exam. And when we have longer lists, just by simply scrolling down, you can make your selection rather quickly. Dermatomes. And then, of course, mensuration, pathological reflexes, cranial nerve exam, concussion findings, and then Weber and Renee tests. And then under orthopedic exam, and in particular cervical orthopedic, but we also have these systems set up within the other regional exam systems, active range of motion, passive range of motion. And of course, you can identify in the range of motion exactly what that degree was, if you like, as well as any other qualifying features that occurred with that in range of motion. And that can be done either through macros that have been set up or, again, utilizing the free text box. And then within most of the orthopedic systems that you see represented in this exam section, there will be areas where there will be diagnostic clusters. So for instance, nerve root compression tests, these 4 tests have been clinically proven to help support the likelihood of nerve root compression. So for instance, Sperling's compression test, let's say it was positive on the right, distraction test, positive on the right, upper limb, positive on the right, and that the patient had less than 60 degrees of cervical spine rotation. Well, what does that tell us? Well, let's go ahead and take a look at the note to get a good feel for why this can be an important part of documenting your exam, especially as it relates to supporting your diagnosis and help you in clinical decision making. And so you'll see here under cervical orthopedic, we will go ahead and enlarge the screen. We have our range of motion that we've noted. And of course, we did not complete that section. But if we take a look at the findings for nerve root compression, you'll see that it's referenced on the literature with the likelihood ratios with 2 of 4 positive findings, 3 of 4, and 4 of 4. And with the higher likelihood ratios, the reliability and accuracy of determining if there are significant findings for nerve root compression become quite apparent. And so we have the likelihood ratios in addition to what those positive findings were. And again, what it'll do is it'll help us support what our diagnosis is for the patient. In addition to that, it helps support our treatment plan for that diagnosis. So let's move on further down. As we're getting a good feel for these sections, we can see how important it is, how they've been laid out. We will move on to functional assessment. In this particular section, we've identified a note format for the physical performance test and measurement with this written report to document the service provided as 97750. And as you scroll down, you can see this particular performance eval helps document a good baseline for this patient prior to starting any type of functional improvement or rehabilitation. Below the functional assessment, we have a balance assessment section, and along similar lines, we identify what are those outcome tools that are important for determining the patient's balance assessment, and those live in this particular section. Next, we have diagnostic orders. Now, the diagnostic orders section is where the provider would go ahead and document any particular test, such as X-ray or maybe even advanced imaging, such as MRI, that the patient may require. So by selecting the search button, it opens up categories that we can have for those particular tests that are either performed in-house or maybe that the provider is referring out. And by making that selection and clicking OK, it documents that particular order for those X-rays. Now, if this is a referral for those X-rays to an outside diagnostic lab or X-ray facility, then you can preview that diagnostic order and print this diagnostic order to be able to provide to the patient. And so this can be saved, it can be printed, and you'll see the information of the clinic, the diagnostic order, the patient's name, the referring provider, and the order itself. Next section is the radiology report. And this is our section where you will see the systems laid out within this section outline that radiology report, such as the reason for the study. What were the general indications? Was it based on pain? On a number of these different factors that could be involved with pain, based on the patient's history, based on any clinical facts or clinical suspicion. We also have within this section the Canadian C-spine rules that are well documented, thoracic compression fracture rules, knee fracture rules, and then of course ankle foot X-ray rules. These all help document, based on the literature, the reasons or indications for an X-ray study. Next, you can determine what views you're ordering if you want to document that within the radiology report. Now, what's important to note is that if you are performing these in-house, these codes will automatically drop into the charge capture. There are also areas within this section for reading radiographs from an outside source, advanced imaging overreads. And then as we move on down into the different regions that are identified, documenting those particular elements on X-ray analysis, such as the alignment, such as the bone and cartilage and soft tissue, and then any particular stress views that could have been noted. The image section. The image section is an area that you can bring images into the patient's note. They can be pre-selected images that you already have that maybe you would like to use as identifying certain aspects of the patient's condition. So for instance, let's say that we want to document a pain drawing that the patient has. And so this patient came in with neck pain and they have radiation going down into that right elbow. And there could also be another section where maybe the patient's identified. But you can go ahead and do some annotation on any types of images that you would like to bring into the system that may be relevant to your overall evaluation process. And once this is completed, it can be attached to the note and will show up inside of the note. You can also bring in X-ray images and attach those into the note as well. Video clips can also be added and brought into the note. Finally, the assessment section is a key area that can help document the provider's thoughts as to the overall care management of the patient. And on the initial visit evaluation, it's a great area to be able to lay out what are those complicating factors that are involved with the patient and how that could affect the patient's recovery. if there's any treatment barriers, any red flags identified. And of course, these are all key areas of concern and consideration for the provider in determining his or her approach to the patient care and what to expect for recovery. What about the prognosis, acute prognostics, or are there any chronic prognostic factors that we know would lead or could lead to chronicity? And then finally, what do we expect for progress? Where are they at? What do we expect the rate of progress to be? And during reevaluations, this section as well is very key in helping either explain or demonstrate progress of the patient based on the treatment and treatment plan goals. Problem diagnosis section. This is the section where we assign diagnoses for the patient. So to bring in a new diagnosis for the patient, you can do it a couple of different ways. First of all, you can just do a direct search in the search field by just typing in 2 or more characters, and you'll see the drop down. Or what you can do is that you can click on this search button, which brings you into this area of the note where you can have diagnosis codes set up per category. So for instance, we are in the neurological section, and this happens to be neurological ICD-10 codes that have been selected as common ones that are encountered. Likewise for Medicare diagnosis codes, trauma, external cause factors, structural, subluxation, and by selecting that right arrow button, you can see that further categories can be developed. And as you think about your practice, these particular categories can have whatever you readily identify as a system to help you find the diagnosis codes quickly. So for instance, instead of maybe this hierarchy of diagnostic coding, you may have neck or cervical spine, thoracic spine, lumbar spine, upper extremity, lower extremity. It could be per procedure, especially in regards to medical procedures where specific diagnoses are required. But this allows for you to be able to make those selections accurately. Once those diagnoses have been identified, you'll see them listed. And finally, with the visits that you have moving forward, selecting only those diagnosis codes that match up to what you're doing for that visit is important. For instance, are you treating the lumbar spine or the cervical spine condition? In multidisciplinary practices, there will be a wide range of diagnosis codes, some medical, some physical therapy, some chiropractic, but depending on your provider type, it's important to just identify with those problems or diagnoses for which your treatment plan is focused upon. Next, we have the treatment plan section. Now, you'll see in this multi-D office visit note, we have a medical plan of care with prescription, we have a chiropractic treatment plan, physical therapy plan of care, and durable medical equipment prescribed. And so let's just open up chiropractic treatment plan since we are doing this note from a chiropractic provider perspective. And so we do know based on Medicare requirements and requirements by other insurance companies that there are 3 key areas within a chiropractic treatment plan. Specific measurable goals, and we have identified 3 key categories: pain, function, and range of motion. But out of these 3 key areas, function is by far the most important category of goal to be documenting and working towards. Secondly, duration of care, and third, frequency of care. And you'll see when we open up this treatment plan, the very first thing is discussion of the treatment parameters and then documenting informed consent. And you'll see that it pops up today's date. We'll just click OK. If it is a minor consent, then documenting the parent or guardian name would be an important part in the patient's record. Now we will cover the consent form in another part of this module. Then we have pain goals. So it's documenting what is our pain goal. Do we want to achieve a preclinical or pre-incident status? For instance, the pre-incident status, let's say the patient didn't have any pain prior to the motor vehicle accident that we've documented. Next would be the functional activity goals. And so the functional activity goal will be based on that function that is being limited by the injury or pain. So for instance, we'll say that sitting is a function that is being limited by the pain. Now we can document or measure that based on a number of ways. Using the patient-specific function scale, which is a validated tool, 0 unable, 10 fully able to perform. We could also measure sitting in minutes or hours. And so we're going to go ahead and click on minutes, and we want the patient to be able to do what they were able to do and achieve that 60 minutes. That would be our goal because that's what they could do prior to the injury. Finally, we also can do objective findings as goals. And when we look at range of motion, let's say cervical spine, we had a restriction of flexion, and we'll go ahead and say we want to bring the patient to 45 degrees of flexion, that lower limit of normal. And again, by far, functional activity goals are the key, specific and measurable, and they help determine what that endpoint of care is going to be. Next, the duration of care, and that can be in the total number of weeks that it will take to resolve the problem, and the frequency of care would be the total number of predicted office visits, treatment visits that would be required for the patient to be able to recover through that duration of care. So we have our treatment plan set, we have our goals, our pain goal, functional activity goal, range of motion goal, as we gave examples on those, and then of course frequency and duration of care. Finally, which helps round out the treatment plan, would be the care management. So what are the types of therapies that under the chiropractic treatment plan would be carried out? Well, chiropractic adjustment, maybe therapeutic exercise. There might be some mechanical traction that's involved in electric stimulation, and possibly low-level laser. Next, we can identify when are we going to reevaluate the patient in terms of visits. Well, we're going to do 10 visits, reeval. And then you can see some other macros that may help describe how that patient will be managed. So dropping down, is there co-management with another provider? And who is that provider's name? And who is the care managed by? Is there a provider referral for like a second opinion or primary care referral? And then finally, if this is a chronic care management situation and you are withdrawing therapy from the patient to see how they respond, this is another area where you can document the need for supportive care. So your care management helps provide some context around the treatment plan that you have prescribed. Similar for physical therapy plan of care. Medicare lays out the documentation requirements for long-term functional goals, types of services and interventions, frequency, duration of care, and self-care management recommendations, in addition to progress reports that are important on a periodic basis. And then finally, within the treatment plan approach, the DME prescribed section helps document those specific durable medical equipment prescriptions for the patient are completed accurately. So beginning right away, what level is the patient? And we'll just say that the patient is active. And of course, Medicare has that definition and that's laid out there. And let's say the patient needs a knee brace. Well, what are the indications for that knee brace? Well, as you can see here, we would document those indications based on our exam findings. And so let's say that there was a positive anterior drawer sign and there's x-ray evidence of osteoarthritis. Then documenting what is the size, what is the quantity, and then is it left or right? And that properly documents the medical necessity for that particular durable medical equipment that has been prescribed. And then finally, the procedure section within this multi-D office visit note. And so under chiropractic procedures, we have here where we can document the evaluation and management for today's visit. So either based on time or medical decision making. And so we're going to go ahead and document the 99203. And we had 44 minutes that we spent both face-to-face and non-face-to-face on this date of encounter. So as a sidebar comment, based on the coding guidelines, you can see that the total time requirement when documenting time would include on this particular day, it has to be on the date of encounter of the exam, would be preparing to see the patient, reviewing tests, obtaining and reviewing separately obtained history, performing examination, counseling or educating the patient, family, or caregiver on that day, ordering any tests or procedures, referring or communicating with other providers, and you'll see in bold, documenting clinical information in the electronic health record, independently interpreting results, communicating results, and care coordination. All of the time that it takes to do this by the provider can be totaled as the total time to go towards that coding for the evaluation management service. And so as we look at those time elements for new patients and established patients, you'll see within the system we have that outlined for you so that you make the correct selection for coding purposes. In addition to that, you'll see that this code later on in charge capture will be available for code extraction. Next, we're going to go ahead and select spinal manipulation. And we did 1 to 2 regions. And now as we would go ahead and document what we did on that particular patient for that day and what regions were adjusted or manipulated. And then select anything that might be relevant for that patient. And then finally, let's say that we did a therapy, 97014, and we had it set up to be delivered at a certain mode, and we did it for 15 minutes to the cervical spine region, the right paraspinal, right levator, right upper trapezius region, and right suboccipital region. And likewise, physical therapy procedures, depending on what was performed. This is laid out for the physical therapist to document their evaluation and to document specifically those therapeutic exercises or activities for the patient under the correct parameters and documentation requirements necessary for reimbursement. And as you can see under procedures in this multi-D office visit note, there are medical procedures such as trigger point injection, viscosupplementation, joint injection, PRP procedures, and the like. We also have a patient education section that can be utilized by all provider types, and we will select the search button, which opens up categories of the types of patient education materials available that are already within the iPatient Care library. And in addition to that, new categories can be created specific for the practice, utilizing the patient brochures, exercise instructions, and the like that are provided to the patient would be available for selection. And once they're available for selection, and we'll go ahead and select the BMI, and we will click on this little eyeball preview, which opens up that particular item, which can be printed and provided to the patient. And then under procedures, the recommendation section can be that section where you have documented the advice that you've provided the patient, documenting any particular restrictions in work. So let's say that we will restrict the patient's lifting. Sitting. And we want them to avoid bending and reaching overhead. We're going to reassess those restrictions in about a week. And we have a section for sport restrictions, very similar. And finally, that leads us to charge capture. So selecting charge capture brings us into the charge capture section, and we'll see at the top our diagnosis codes. We'll see the area where the CPT codes will be populated, as well as an area that we can search and add evaluation management codes. Now, we've already documented our procedure, including our exam, within that procedure section. So how do we bring those codes into the CPT section of charge capture? Well, you'll come down to the bottom and you'll see this button called Extract Code. We'll select that. And now you see the code selections that have been brought forward from the procedure section, as well as that DME prescription that we completed. And you would simply select the top box, which would bring them all in, and click OK. And there our CPT codes have been entered into the system. Now the next part of this is very important, and that is linking the diagnosis codes to the procedure. So if all of our diagnosis codes are related to our procedure, then simply selecting the Link All button will link all of the procedure codes to all of the diagnosis codes. However, in the event that that's not the case, and there's certain procedures that are specific to a specific diagnosis code, you can go ahead and click on the link button again, and then selecting that procedure, let's say electric stimulation, and then deciding, okay, where did we need to tie that to? And then move on down and select the procedure with the specific diagnosis codes. And then you can complete it that way. Once that diagnostic code linking to the CPT code has been performed, and if there have been any modifiers that need to be identified per the procedure code, so for instance 99203, we know that that needs a modifier because there were procedures performed on this same day. So we've selected 99203, and then next we will search for the modifier, and so we'll click the search button. And we know that we need to add the -25 because the exam and adjustment was done on the same date. And that modifier now is added. And that finishes our note. And so let's take a quick preview of the note. So coming down below charge capture, we have a preview section. We will select that. And now we can preview the note to see how it looks before we sign the note. And as we've mentioned, you can see the dark blue, the section, visit type, visit number, HPI, subjective outcome, assessment, past family medical social history. You can see in bold and underlined the note system, and then in regular font print, the macro elements. And reading through the note to make sure that it's concise, we haven't missed anything. And then we can go ahead and move forward with signing the note. And you can also see those body images as well as X-ray images that we attached in the note. So there's our note. We can print it, we can route it to another provider for review, and we can go ahead and sign the note. Now, you'll see that there are pop-ups that can be assigned and programmed within the system to make sure that certain areas have been documented. So we'll just click OK to bypass that. And we will go ahead and type in our electronic signature to sign the record. And there we have completed the record. So we'll save and close.